Hi friends, I'm Dr. Nihar Mehta. I'm a consultant cardiologist at Jaslok Hospital. Today I'm going to talk to you all about something which impacts every single viewer directly or indirectly. High blood pressure. So we all know that when you go to a doctor's clinic, the first thing that is checked is your blood pressure, your pulse, your vitals. Why is this? This is because high blood pressure is an epidemic which is far more dangerous than the COVID epidemic. Do you know that today there are 1.2 billion people in the world who suffer from high blood pressure? In India, the number is staggering. As many as 30% of all adults above the age of 18 suffer from high blood pressure. What does this mean? That means 1 out of 3 adults, not over the age of 30, 40, and 50, over the age of 18, 1 out of 3 adults has high blood pressure. How many of these know about the high blood pressure? Very, very few. Less than 50% know that they have high blood pressure. And amongst those who actually know they have high blood pressure, hardly 20% have their blood pressure under control. This is a problem all over the place. Whether you live in a city, whether you live in a town, the percentages are staggering. Men, women, everyone suffers from high blood pressure much more than we understand or expect. Now, is blood pressure benign? Many of us will think, my blood pressure is 140, 150. डॉक्टर ने बोला है कि 160 बीपी आपके एज के लिए अच्छा है. Is this true? Does blood pressure actually come with problems, with complications, with other issues? And the answer is resounding yes. Blood pressure basically is the pressure which drives blood all through our body, from our head to our toe. Therefore, if the blood pressure is high, it can cause problems from our head to our toe. From our head, blood pressure is responsible for 35% of all strokes or paralytic attacks. When it comes to the heart, blood pressure is responsible for 45% of heart attacks. It is related to eye disease, kidney disease and kidney failure, problems with circulation in your feet, and what is called peripheral vascular disease. So, like I said, from your head to your toe, blood pressure can affect us negatively. Everybody needs to know what their blood pressure is and needs to keep it under control. The word silent killer was designed for high blood pressure. Why? Because blood pressure does not have any symptoms. Hardly few percent of people will have a headache when the blood pressure is very high, but majority of us will go to a doctor, realize, "Arey, my blood pressure is 170, I am not even feeling anything." That is because blood pressure has no warnings, no symptoms. The thing it will come with is a heart attack or with a stroke, and then you realize, "Arey, my BP was high and I didn't know about it." So, the cause for blood pressure, unfortunately, is not one particular thing. There is no one reason that our blood pressure is high. A large amount of it is related to our genetics, to our constitution, to our diet, to our lifestyle. So it's not a single treatable factor. Treatable causes of blood pressure are very rare. They are related to your kidney or to your adrenal glands or to your sleep patterns, but those are something which are seen in less than 5% of people. 95% of people have no treatable cause for blood pressure. That is why not only is it a silent killer, it is an untreatable disease. Therefore, it can only be controlled but not cured. Now, all this sounds so serious because it is actually something which we need to take account of, and we need to take this one step forward. Now, friends, I'm going to tell you all a simple way that where you can monitor your entire family's blood pressure without even needing a doctor. And that is with automatic BP machines. Every family in India should have one automatic BP machine in their household. With that one machine, everybody can have a look at their blood pressure. If you're feeling uncomfortable, if you are already a blood pressure patient, if you have high sugars, keep a regular watch on your blood pressure. What is normal blood pressure? For all people, the blood pressure should be below 140 and below 90. That is called normal or high normal blood pressure. Once it goes above 140, the upper one, that is the systolic, and 90, the lower one or the diastolic, that is called hypertension or high blood pressure, and it needs treatment immediately. So, a simple automatic machine at home can lead to you diagnosing what your blood pressure is so that you can get it under control very easily. Now, friends, I'm going to give you all a very simple formula of how to control and prevent blood pressure. So, this formula is good for people who don't have high blood pressure so that they don't develop it, and also for people who have high blood pressure so that they can control it. It is a simple formula of 8 S's. So, let's talk about these S's. Number 1, directly related to blood pressure, is salt. So, keep your salt levels down. Make sure you're having normal salt but no excess salt, table salt, achars, namkeens, nashtas, farsans. All these things are excess salt. Keep that away. Number 2, sugar. Keep your sugar and carbohydrate content down. Make sure your sugars stay in control. Number 3 is a sedentary lifestyle. Make sure that you're not sedentary. Make sure that you're walking regularly, doing at least 30 to 45 minutes of good cardio exercise like walking, cycling, swimming every single day of your life. Number 4, smoking. Make sure that you're staying away from every kind of smoking, cigarettes, vapes, hookahs, e-cigarettes. Everything should be avoided completely. Number 5 is sleep. Sleep is an essential part of our health. You should sleep before midnight, sleep for 6 to 8 hours, and sleep regularly on time and sleep deeply. In case you snore a lot, look for sleep apnea as a part of blood pressure. Number 6 is screen time. We should make sure that our screen time is kept to a bare minimum so that the screen effect also causes a lot of stress and a lot of blood pressure problems. 7 is stress levels. Everybody in today's life and day and age is faced with stressors, whether they're at home, they're at work, they are financial, they are personal. Stress is also directly related to blood pressure. Keep our stress levels down by doing simple things like yoga, meditation, pranayam, breathing exercises every day for 10 or 15 minutes. This will reduce your blood pressure and keep your health intact. And the last thing is screen yourself. Make sure with the automatic machine, you're checking your blood pressure regularly and making sure it is staying within that 140 and 90 range so that you don't become a patient of high blood pressure. So friends, with all these 8 S's and with these little tips on prevention, I hope that we can all keep our blood pressure in control so that you are away from all the problems and side effects of this silent epidemic, this silent killer, which is there in everyone's house. It's just that we don't know about it.